Welcome to our informative YouTube video on recognizing the early signs of a heart attack and learning essential tips for prevention. Heart health is paramount, and understanding the warning signs can be a lifesaver. Identify early signs. 1. Chest discomfort. 1. Some individuals may experience mild discomfort, pressure, or a squeezing sensation in the chest that comes and goes. 2. Intense chest pain or discomfort that may feel like a heavy weight on the chest, often lasting for several minutes. 2. Shortness of breath. 1. Feeling slightly winded during everyday activities, such as walking or climbing stairs. 2. Severe breathlessness, gasping for air, or difficulty breathing even at rest. 3. Fatigue. 1. Unexplained tiredness or a decrease in energy levels. 2. Profound weakness, fatigue, or exhaustion, often accompanied by other symptoms. 4. Pain or discomfort in other areas of the upper body. 1. Pain or discomfort in the neck, jaw, shoulder, back, or stomach. 2. Intense pain radiating from the chest to these areas, often on the left side. 5. Nausea or indigestion. 1. Mild stomach discomfort or queasiness. 2. Severe nausea, vomiting, or intense indigestion that feels different from normal. 6. Cold sweats. 1. Slight perspiration or feeling clammy. 2. Profuse sweating, often accompanied by other symptoms. 7. Lightheadedness or dizziness. 1. Feeling a bit off balance. 2. Severe dizziness or sensation of almost passing out. Risk factors. 1. Poor diet. 1. High intake of saturated and trans fats, cholesterol, and sodium can increase your risk. 2. Diets low in fruits, vegetables, whole grains, and fiber can also contribute. 2. Sedentary lifestyle. 1. Lack of physical activity or regular exercise can lead to obesity and increase the risk of heart disease. 3. Smoking. 1. Smoking and exposure to secondhand smoke significantly raise the risk of heart attacks due to the damage caused to blood vessels. 4. High blood pressure, hypertension. 1. Uncontrolled high blood pressure puts strain on the heart and arteries, increasing the likelihood of a heart attack. 5. High cholesterol levels. 1. Elevated levels of LDL, bad cholesterol, and low levels of HDL, good cholesterol, can lead to plaque buildup in arteries. 6. Diabetes. 1. Poorly managed diabetes can damage blood vessels and the heart over time, increasing the risk of heart attacks. 7. Obesity. 1. Excess body weight, especially abdominal fat, can lead to conditions like metabolic syndrome, which heighten the risk of heart disease. 8. Family history. 1. A family history of heart disease, especially if it occurred at a young age, can be a risk factor. 9. Age. 1. The risk of heart disease increases with age, with men typically at higher risk after age 45 and women after age 55. 10. Gender. Men generally have a higher risk of heart attacks, but the risk for women increases after menopause. 11. Stress. High levels of chronic stress can contribute to heart disease. 12. Excessive alcohol consumption. Drinking too much alcohol can raise blood pressure and contribute to heart disease. 13. Sleep apnea. Sleep disorders, particularly sleep apnea, are linked to an increased risk of heart attacks. 14. Previous heart conditions. Individuals with a history of heart disease, heart attack, or other heart-related conditions are at a higher risk of recurrence. 15. Drug abuse. The use of certain drugs, such as cocaine and amphetamines, can increase the risk of heart attacks. Prevention strategies. 1. Adopt a heart-healthy diet. 1. Focus on a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. 2. Limit saturated fats, trans fats, cholesterol, and sodium. 3. Choose healthy fats like those found in olive oil, nuts, and fatty fish, omega-3 fatty acids. 4. Control portion sizes and be mindful of calorie intake. 5. Reduce added sugars and sugary beverages. 2. Stay physically active. 1. Aim for at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous intensity exercise per week. 2. Incorporate strength training exercises at least 2 days a week. 3. Find activities you enjoy to make exercise a regular part of your routine. 3. Maintain a healthy weight. 1. Achieve and maintain a healthy body weight through a combination of diet and exercise. 2. Consult a healthcare provider or a registered dietitian for personalized weight management guidance. 4. Manage blood pressure. 1. Monitor your blood pressure regularly. 2. Follow your healthcare provider's recommendations for medications and lifestyle changes to control hypertension. 5. Control cholesterol levels. 1. Get your cholesterol levels checked regularly. 2. Take prescribed medications as directed by your healthcare provider. 3. Follow a heart-healthy diet to reduce LDL, bad cholesterol. 6. Manage diabetes. 1. If you have diabetes, work closely with your healthcare team to keep your blood sugar levels in a healthy range. 2. Monitor your A1C levels regularly. 7. Stop smoking and avoid secondhand smoke. 1. Quit smoking if you are a smoker. 2. Avoid exposure to secondhand smoke. 8. Limit alcohol consumption. 1. If you consume alcohol, do so in moderation, up to 1 drink per day for women and up to 2 drinks per day for men. 9. Reduce stress. 1. Practice stress reduction techniques such as meditation, deep breathing exercises, yoga, or hobbies that you enjoy. 2. Seek professional help if you are struggling with chronic stress or anxiety. 10. Get quality sleep. Aim for 7-9 hours of restful sleep per night. Maintain a consistent sleep schedule and create a relaxing bedtime routine. 11. Stay socially connected. Maintain strong social connections and engage in supportive relationships. 12. Follow medical advice. Attend regular checkups with your healthcare provider and follow their recommendations for heart health. 13. Be informed. Educate yourself about heart disease and its risk factors to make informed decisions about your health. Emergency response. 1. Call 911 immediately. 1. If you or someone else is experiencing symptoms of a heart attack, such as chest pain, shortness of breath, and other signs mentioned earlier, call 911 or your local emergency number immediately. 1. Do not delay. 2. It's essential to get professional medical help as soon as possible. 2. Emergency medical services can provide life-saving treatment and transport you to the hospital. 2. Stay calm. 1. Try to remain as calm as possible while waiting for emergency responders to arrive. 3. Assist the person. 1. If you are with someone who is experiencing a heart attack and they become unconscious and unresponsive, you should start CPR, cardiopulmonary resuscitation, if you are trained in it. 4. Administer CPR. 1. If you are trained in CPR and the person is unresponsive and not breathing normally, begin CPR. 1. Here are the steps. 2. Place the person on their back on a firm surface. 3. Kneel beside them and place the heel of one hand on the center of their chest, just below the nipple line. 4. Place your other hand on top of the first hand, and interlock your fingers. 5. Use your upper body weight to push hard and fast, aiming for a rate of about 100,120 compressions per minute. 6. Allow the chest to fully recoil, come back up between compressions. 7. Continue CPR until professional medical help arrives or the person starts breathing on their own. 5. Use an automated external defibrillator, AED, if available. 1. If an AED is nearby, and you are trained to use it, follow the device's instructions to deliver an electric shock if advised. 1. AEDs can help restore a normal heart rhythm. 6. Do not drive yourself to the hospital. 1. It's important not to attempt to drive yourself or the person having a heart attack to the hospital. 1. Emergency medical services have the equipment and expertise needed to provide immediate care. 7. Follow medical advice. 1. Once at the hospital, medical professionals will evaluate the situation, perform necessary tests, and provide appropriate treatment. 1. Follow their guidance for the best possible outcome. Being prepared and knowing how to respond to a heart attack can make a significant difference in the chances of survival and recovery. Remember that acting quickly and calling 911 is the most critical step. CPR can also be a life-saving intervention, so consider getting trained in CPR to be better prepared for emergencies. Join us in this journey towards better heart health. Whether you're young or old, it's never too early to start taking care of your heart. Don't forget to like, share, and subscribe to our channel for more valuable health content. Let's spread awareness and save lives together. Remember, your heart matters, and your health is in your hands. Disclaimer: this video is for informational purposes only and should not be considered a substitute for professional medical advice. Always consult with a healthcare provider for personalized guidance on your health.